And now we're going to the city of Mulberry, which is a small rural community located in Central Florida, to look at some of their brownfield projects and how they're actively seeking to establish healthcare within their brownfield community.
Hello, my name is George Hatch. I'm the mayor of Mulberry, Florida. We're located about halfway between Tampa and Orlando, south of Lakeland. We live in the shadow of these bigger cities, and we tend to need things that bigger cities have, but the city is not available or able to provide. And we're looking forward to a new health center in our arena. We have several businesses in the community. Some of the businesses, many of the businesses revolve around phosphate, styrofoam cup company, we have an environmental company, we have a furniture company, just several larger companies that provide services to our citizens. But many of our citizens in this area live outside the city limits of Mulberry and as much as 20 miles away. But we are the closest city to their home. And as such, these citizens need a health facility in our arena. Many are poor and cannot afford to go to a hospital that might be 40 miles away from where they live. So a new health facility in the city would help alleviate that problem. The city has graciously agreed to donate some land that was previously a brownfield site, and so we're going from a brownfield to a health field, hopefully, and that'll just make or break, not break, but it's going to make a better area for the citizens of our community in which to live.
My name is Helen Sears. I'm Program Director of the Central Florida Regional Planning Council, and I've been working with the Brownfields program since 2009 through an EPA Brownfields grant. The grant enabled us to work with the community closely with the city of Mulberry, and through that process we learned that the city needed health care services and that was a big hole in what was available to the citizens of Mulberry. The community felt the loss of a local healthcare center, which hasn't existed in the community for some time now, very deeply. And every response that we've had, and we've done a survey, community survey, sent out to everyone in their electric bills and through every other medium we could think of to find out not only what they felt they needed, but how they felt about the idea in general and would they use it. And their response was, yes, it was needed, and they were very specific about the kinds of needs that they had, and that they would, a very large percentage indicated that they would use the clinic. The committee is composed of the city fathers, it's composed of the council members, but more importantly, and staff of the city of Mulberry, and most importantly, the city residents that have been active in the community for many years, doing many different things to try to develop a better community. The project is a partnership between the city and the Central Florida Regional Planning Council and the Brownfields folks and our consultants and the Central Florida Healthcare, which is a provider of comprehensive healthcare services in the Central Florida region, not only in our county but in 2 other counties as well. And they have established federally qualified health centers which provide comprehensive services, and that's what the citizens felt was needed in the city of Mulberry. I would hope that we could have health care available to everyone regardless of their ability to pay, and that through a network of service providers like Central Florida Healthcare and other providers that exist, that every community could have a conveniently located, full-service healthcare center.
Hello, my name is Gay Williams, and I'm the Chief Executive Officer of Central Florida Healthcare Incorporated. Central Florida Healthcare is a federally qualified health center with health centers in 3 counties in the cities of Frostproof, Lake Wales, Winter Haven, and you're at the beautiful Winter Haven Center, Dundee, Lakeland, Avon Park, and Wauchula. Central Florida Healthcare provides comprehensive primary and preventative health care to a large population of individuals who do not all have the ability to pay for health care. Central Florida Healthcare is Joint Commission accredited, and we have been accredited since the year 2000. Our mission is to increase access to affordable, quality, primary and preventative health care. Our vision is to improve health, enhance quality of life, build strong, solid partnerships, and focus on excellence. Our patients are culturally diverse, and as a result, we have culturally diverse staff in place to make sure that we take care of the patient's needs. When we were approached by the city of Mulberry, we were excited about the opportunity to come and speak about the model of care that we provide at Central Florida Healthcare. We met with the city officials, we did a couple of presentations, and then we formed a work group. We were blessed to have a community developer out of Atlanta help us to write a health resources services planning grant, and the grant was funded for $80,000 for the city of Mulberry. Now, before I talk further about our work efforts, let me just say that Central Florida Healthcare is funded in part by Health Resources Services Administration Bureau of Primary Health Care. Our patients, again, are culturally diverse, and they include the Medicare, Medicaid, other third-party group, and a large number of patients who do not have the verified ability to pay, and so they pay based on a sliding fee scale. So what we have been able to do thus far, we have been very blessed to get the city to donate property that's on brownfields land, EPA brownfield. There was an assessment performed to make sure that the land is hazardous free. With that, we were able to write a couple of applications, with the most recent application being a school-based pediatric application, which will allow us to put a small school-based pediatric clinic to start with on the brownfields property. Now, some of the steps that occurred in our work efforts include a needs assessment, because we absolutely needed to determine that the need was there in the city of Mulberry. What we found out in our work, we found out that when compared to Polk County, where the city of Mulberry is located, that there are alarming statistics. Such include the poverty level when compared to the county, 200%, 100%. We also looked at the health disparities, and the health disparities were alarming, to say the least, in that we looked at arthritis, we looked at asthma, obesity, cholesterol, cardiovascular, dental, and we knew then that the results were enough to validate our moving full speed ahead to try to get a health center in the city of Mulberry. What's important for you to know is that you should be working with your federally qualified health centers. Federally qualified health centers are located in every state and every territory. There are 43 corporations like Central Florida Healthcare in the state of Florida, and over 1,200 community health centers in every state and territory. Community health centers are part of integrated delivery systems of care. Community health centers will work to help identify need and will work to help find the resources that are needed to bring health care to any community that is in need. In the case of Polk County, I will also add that Polk County is designated a medically underserved area of population, and such exists across the country. So if you would like to hear more information about our efforts, please feel free to contact me, or better yet, if you're seeing this in another state, contact your community health center in the neighborhood or the primary care association for the community health centers. You can find Central Florida Healthcare at www.cfhconline.org, or you can go to Health Resources Services Administration and find a community health center anywhere in the United States of America. But because you're hearing this from me, and if you wish again to get any additional information, I would be very happy to talk with you and to share more about our efforts to get a health center in coordination with great partners like EPA Brownfields, the Regional Planning Council, and the various cities that I know stand ready to work with you to increase access to health care. Thank you so much for visiting with us and giving us an opportunity to talk about our fabulous program, a program that just celebrated 40 years. Thank you.
I want to thank you. I want to thank you for being interested in what is happening in the city of Mulberry, and for all of the support that both the EPA and astdr and HRSA have given to make new things possible for the city. City has been in a downward spiral for a long time, but with new leadership and new resources, I think its potential is great. And I thank you for all of your help.
This is the first of a series of videos on access to health and healthcare through brownfield redevelopment. And we're very hopeful that communities throughout the country will look at the examples, and when they go by brownfield sites in their community, could be contaminated gas station sites, could be dry cleaners, junkyards, or industrial facilities, they'll look at those in a health focus and a health lens. We hope that this will provide a tremendous opportunity for your community to use the resources we've talked about to truly have a positive impact on the health of your community.